You are listening to Unified Through Chronic and Mental Illness with your hosts, Angie Roberts and Kimberly Murphy. Please be advised that some of the topics of this podcast can be triggering and sensitive in nature.
The Lupus Foundation of America estimates that 1.5 million Americans and at least 5 million people worldwide have a form of lupus.
Hi, Spoonies and Mental Health Warriors. I'm Kimberly here with Angie Roberts.
Hey, guys.
And for those of you who don't know, this month is Lupus Awareness Month. Many of our listeners from Facebook are lupus patients. So in order to keep things interesting today, we are talking about the top 10 complications that can be caused by lupus. But first, for the people who don't know what lupus is, Angie, can you give us all just a quick overview?
Sure. Lupus is a disease that occurs when your body's immune system is overactive and it attacks your own tissues and organs. It sounds so horrible to me because I don't have lupus. So,
and I do.
Yeah.
So
Right.
I do have some experience with this. Yep.
Right. Some of the inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs.
Just that.
Just that, nothing much.
So what are some of the signs and symptoms so that people are aware?
Okay, so the common ones are fatigue, fever, joint pain, butterfly-shaped rash on the face that covers the cheeks and bridge of the nose, or rashes elsewhere on the body, skin lesions that appear or worsen when exposed to the sun, which can cause skin scarring.
Yeah, I have that. I hate it.
Oh.
Yeah.
Fingers and toes that turn white or blue when exposed to cold or during stressful periods.
I think that's called Raynaud syndrome.
Yeah, it is. I have it with fibro, so.
Okay, so that's one of those ones that lupus shares with fibro. There seems to be
a
a lot in common.
Yeah. Okay, and a couple more, shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. The causes of lupus is likely the result from a combination of your genetics and your environment. There are environmental health hazards that cause flares, like sunlight, infections, and some lupus can be triggered by certain types of blood pressure medication.
Wow.
Anti-seizure medication and antibiotics. So, I mean, and which really makes sense. The
Which is like
really
drug-induced lupus. That's
right.
Drug-induced lupus, right? Yeah.
Right. Exactly. Exactly.
So I honestly do believe that my lupus was triggered by the swine flu, which was around at the time, and everybody was getting really, really sick. I was like laying on the bathroom floor wanting to die, and I'm not exaggerating. No. My mom was the same way, and it was really this horrible flu. If anyone out there had it, it was terrible. And then I started getting all of these symptoms. So they do say that infections, viral infections, anything like that can trigger it, and I do believe that's what happened in my case.
That's crazy. I'm sorry that even happened to you, because I know that you're really paying for it now.
So let's get into our top 10 countdown of the conditions that can be caused by lupus. None of these are in any particular order, so we're not saying that one is worse than the other. This is just what we came up with.
We have, at number 10, we have mental conditions such as anxiety, depression, psychosis even. And psychosis is a mental behavioral disorder in which a person may have delusions, firmly held but false beliefs, or hallucinations, which are false perceptions, or may have both, is seen in some people who have lupus. It can be caused by a disease or by medications such as tranquilizers and such things.
Yeah, because a lot of like the steroids and the painkillers, like oxycodone and things that they give out. Well, they used to. They don't give them out as much anymore, but those types of things can definitely, I think, cause psychosis. I can't really speak on that because it hasn't happened to me, although I can say that I did have a very deep depression, which is actually what got me diagnosed. They had to diagnose the depression first and take care of it so they could see what symptoms were left over. And I know that frustrates a lot of people, because you're frustrated because your doctor's doing this and you're talking about something completely different. But in order for them to figure out that I had lupus, they had to rule out other things first. So they treated the depression first.
Mm-hmm.
And then they explained it was a chronic condition caused by lupus.
Oh, wow. Okay.
Mm-hmm. Yep.
It's so sad how these diseases like really just take your whole body over. But
Yeah.
okay.
Yeah.
So at number 9, speaking of taking your body over, the brain and the central nervous system. If your brain is affected by lupus, you may experience headaches, dizziness, behavior changes, vision problems, or even strokes or seizures.
Yeah.
And then many lupus patients experience memory problems.
Yeah. Memory problems is a big one. The whole brain fog. And
Right.
I know we've even done it on this podcast where we're like stumbling over the word that we know we want to say, but it's just not coming out. So
Right.
sometimes it's hard to just even express a simple thought. But for me, the headaches got really severe at first. And that was kind of another indicator that I had lupus. I ended up in the ER with headaches that were so severe. And I do know people have seizures and strokes. I fortunately have not had those issues, but
That's good.
yeah.
I'm glad
Yeah.
you haven't.
But I mean, everybody's different. So.
Did you have any vision problems with your headaches, or did
Oh
you think
yeah. Mm-hmm. Yeah. My vision would get really blurry. And they even tested me for diabetes type 2 because I showed some of those symptoms, but that was negative. So, it gets really frustrating because you really do need to go through a process of elimination when it comes to something like lupus, where there's no definitive test.
It's a very complicated disease.
It is, yeah.
Number 8, we have blood and blood vessels. Lupus may lead to blood problems, including a reduced number of healthy blood cells or anemia, and an increased risk of bleeding or blood clotting. It can also cause inflammation of the blood vessels.
I did have some issues with my red blood cells being really low. So I did have anemia at one point. Fortunately, I haven't had a lot of the inflammation of the blood vessels, but blood clotting is a huge risk factor. When I was getting lots of headaches and when I had a change in my face on one side, they were extremely concerned that I had a mini stroke or I had a blood clot in my brain. So, so they take that very seriously, the blood clotting and the risk of bleeding. Fortunately, I didn't have that. They found out I had a little kind of like mini tumor it's benign, that I've had since I was born. So they figured out that, but there was nothing else going on, thank goodness.
Oh, well, thank goodness.
Mm-hmm.
Yeah. I have to sit back and really think. And when I think about, what the definition is of lupus, it really,
Mm-hmm.
and then hearing this, it all brings it kind of into
focus.
I knew about lupus, but I really didn't know about lupus until I started researching it. Really, really. So, you know what I mean? Like,
there's a lot involved that people don't know.
Be.
Exactly. Yeah. A lot of people are like, how did this, like when young girls die of lupus, they're like, how did that happen? Did she have other, things going on? Lupus can attack somebody very aggressively. It just happens in some people and not in others. It's everyone's different. So, and their treatment is different and how they respond to treatment is different. So all of that is a factor.
It sounds complicated to me.
It is very complicated. It took me 5 years to figure out that I had it. And then it took probably another 5 years to find what medications were going to work for me. I went through a lot of stuff. Yeah.
Yeah, that is a lot.
Mm-hmm.
Okay, so back to our top 10. Number 7 is the lungs. Having lupus increases your chances of developing an inflammation of the chest cavity lining, which it makes breathing very painful. You can bleed into the lungs and get pneumonia also.
Right.
Those are both possibilities.
I know that every time I go to the doctor, he asks me if I've been coughing, because when I lay down, I cough a lot, which is an indication not just from lupus, but also for those of you who take methotrexate out there, the listeners, they all know that is also a kind of a sign that you're allergic to the medication. So you could be on it for a couple of years and then all of a sudden you're coughing. I decided to stay on it even though I do have some coughing because it works the best for me. So I've decided that little symptom right there is worth living with. Sometimes you have to make those choices, which is not easy.
I can understand that from mental health medications.
Mm-hmm.
I have a slight twitches sometimes or shakes in my left hand from the mental medications.
Mm-hmm.
And it's either go off of it or just deal with the little shakes every now and then. So
right. So you just have to weigh
well
the
enough
risks.
for me.
Mm-hmm.
Yeah, and it's
Yep.
some of these medications.
Yeah, you have to weigh the risks versus the benefits, and we're all kind of in that position if we're dealing with anything that's chronic.
Okay, so number 6 is the heart. Lupus can cause inflammation of your heart muscle, your arteries, or your heart membrane. The risk of cardiovascular disease and heart attacks increases greatly as well. Cardiovascular disease, not lupus itself, is the number 1 cause of death in people with lupus. It's actually the number 1 cause of death around the world. And the number 2 cause of death of people in lupus is infection.
Mm-hmm. Yep. So this is interesting because it's basically saying that not lupus itself. It's saying that the condition of cardiovascular disease, and a lot of people are like, well, you can get cardiovascular disease for many reasons. And that's true. So sometimes you're not necessarily dying from lupus, you're dying from another condition.
Right.
And I think that's what they're saying here is that the number 1 condition of death with anybody is cardiovascular disease. But everyone used to think kidneys was the highest risk because for a long time it was.
Mm-hmm.
But with today's medical help, the risk has been reduced greatly for kidneys. It's still a problem. I'm not saying it's not, but and I think cardiovascular disease, this is just my own personal thought, your heart can be kind of taxed with every flare that you go through. The medications certainly probably cause some stress on the body. And, you really have to kind of be careful because it's a delicate balance to keep yourself as healthy as possible. So,
it really is.
I just found out I have calcification of one side of my heart. So it does happen. Well, I'm getting older too. And it's not unheard
old.
of. But they're saying someone my age is it starts to happen and it's not all that uncommon, but again, that's something I need to keep an eye on because I do have lupus. So
what I'm finding interesting is we're going through this and talking about the inflammation of the organs. A little blurb about fibro. It doesn't affect the organs, but it affects the ligaments and the joints and the muscles.
Mm-hmm.
Well, it affects the muscles. So if your heart's a muscle and your brain's a muscle,
exactly right.
It's not attacking like you guys, the lupus attacks, but you still get the inflammation of the brain. You get the inflammation of the heart. You get the inflammation of things. And it's just, oh gosh, those fibro headaches are horrible.
And we all know that inflammation is damaging to your body. So
yes,
it is kind of doing the same thing, because you don't have the white blood cells attacking your body, but inflammation is one of the leading causes in many diseases. So they say the first thing we should all do is lower our inflammation as much as possible. Yeah.
Yeah, they say a good way to do that is grounding, but that's a whole nother episode.
It is, and we should do that someday. And
Yes,
also diet and exercise can help with inflammation.
it can.
Chiropractor, massage. I mean, we could go
Yes.
on and on. That's a whole nother podcast, like you said.
Yay, I got her to say chiropractor. Y'all, I'm gonna tear up.
For those of you who wonder why I'm laughing, it's because my mother told me that if you go to the chiropractor, you're probably going to die. So, and Angie's
Yeah.
been reassuring me that it's absolutely okay and you're not going to end up with something wrong with you because you went to the chiropractor.
No,
So,
you're actually gonna feel better.
right. My mom's a little overreactive, but
Number 5 is infection. People with lupus are more vulnerable to infection because both the disease and its treatments can weaken the immune system, which is crazy.
yeah, this is what people get like confused about. So a lot of people who are mean well and are very concerned will say, well, you need to take this or this to boost your immune system. And of course, that's the worst thing someone with lupus can do. We're trying to prevent that. The stronger our immune system is, the stronger our disease is. So we take medications to suppress the immune system so that lupus is not active. So that also, though, puts us at risk for infection. Like one time I had cellulitis all at my legs, and it was horrible, and it gave me like an infection where I had to go on antibiotics and all this other stuff. I was told for a while not to even eat out in a restaurant. So because of the medication that I was on at the time. But yeah, this is what, and then, you got to be careful. You don't want to take vitamin C. You don't want to take all these things that like boost the immune system. And a lot of people are not aware of that. You got to keep yourself careful and watch out for those infections because things can crop up really quick. Definitely go to the doctor if you feel like something's wrong. Do not wait, because infections can run rampant. And once it gets into your blood, you're in a really dangerous situation.
That's just scary.
It is. Yeah, it is.
So number 4 is cancer. Having lupus appears to increase your risk of cancer. However, the risk is small. So that's good.
And I think why they're saying this is because some of the medications do carry a risk of cancer. It's not a huge risk, but it's like, do I want to take the medication and risk it? Or, what is it better for me to take it and keep things under control? And in this case, I would say it's worth taking the meds, but I think it's talking about medication.
I have no clue. I'm the fibro girl. I'm not the lupus girl.
I know. And it's too bad we didn't cover fibro because fibro is this month as well, I think. So, but we will get to that. I promise everybody. We're not trying to.
Is it this month too?
I think it is. Like this month has mental health awareness, lupus awareness, and I think fibro as well. So
yeah, we'll get to it, y'all.
We will get to it. Yes, we will.
Okay. So number 3, bone tissue death. This occurs when the blood supply to the bone declines, often leading to tiny breaks in the bone. And the bone then eventually collapses, kind of like a hip destruction. Can you imagine if you
necrosis? Yeah.
Ugh. This kind of, am I wrong that it kind of reminds me of like a building that has all these little cracks and then all of a sudden it just goes?
Yeah, absolutely.
Because
I think people who take prednisone for a really long time are at a huge risk for this, especially. But that's just I'm not a medical doctor, but that's just my opinion. Because I know that when I took prednisone for 5 years and my doctor had me do a bone density test to make sure that my bones were healthy, because the first thing prednisone does is kind of suck all the good stuff out of your bones. And fortunately I was great. My test was wonderful, but for other people, it can really cause your bones to be weak. So I'm thinking maybe it's from that, the steroids, but I'm not sure. I mean, there are blood problems like we were just talking about. So obviously that could result in the bone tissue death as well, I would assume.
Yeah, the bone, blood is made inside of bone.
Right. So if you're having blood issues, yeah.
or bone issues. It
Mhm,
could both
either
be.
or.
Yeah, it can
Yeah.
affect both. I can see that.
Yep.
So number 2 is pregnancy complications. Women with lupus have an increased risk of miscarriage. I did not know this.
Yep.
Lupus increased the risk of high blood pressure during pregnancy and preterm birth.
The strange thing is that before I was even diagnosed with lupus, I did have a miscarriage. When I was pregnant with my youngest child, I had high blood pressure, and I actually had to go into the hospital and have like a fetal monitor put on me every night to make sure that the baby was okay. So it's kind of weird. Like I know I didn't have full blown lupus then, but I'm hearing a lot from the women in the lupus groups that they had like symptoms way before they were sick.
Right.
So I think like that's part of maybe they say the environmental, but it can also be hereditary. So that might be part of the hereditary component.
I wonder if it kind of creeps on you like fibro.
Right. Yeah, I think it does. I really do.
It's one of those creepy diseases.
Yeah.
And the last one we have is skin scarring and sun sensitivity. And I think Kimberly's going to tell us a little about those.
Yeah, and one of the first symptoms I had as well, it was like these rashes all over my body. They're like these little, I don't know how to call it, like if you have chicken pox, you know, you have these little round sores, and then they heal up and they scar. So yeah, so and the sun brings it on mostly. So you'll usually have it like in sun exposed areas, like your arms, your legs. There's also a strange thing that happens to a lot of people where you're sitting in the sun and you'll start getting these patches all over your legs. You can actually see the red just patching like in these patterns. So these are all these little things. And then, you know, the scarring is not limited to the skin. You can scar in your organs from the damage of lupus. Yeah. And they say that every time you have a flare, you're doing permanent damage. So I don't think people really understand that. My joints have really taken a beating. That's really where I suffered the most. And, you know, once that's ravaged, there's nothing you can do about it. So keeping the disease under control is really important. And this also goes under thinning of the hair. Like a lot of people lose their hair in clumps. It's so sad. I mean, there's women that are shaving their heads and wearing wigs now because once it comes out in patches, it doesn't grow back.
Right.
It's like alopecia, so it doesn't come back.
Sometimes they get alopecia where everything just falls out.
Right.
All the hair everywhere.
But you know, sometimes when your flare up is under control, some of your hair will grow back. But you know, if you have scarring on the skin and the follicles die, there's no coming back from that. So, but yeah, it's sad because I mean, people say it's superficial, but you know, when you're a woman who all of a sudden has sores all over her body, your hair's falling out, you're depressed. A lot of women put weight on because of the medications like the steroids. It's horrible. Like it really takes a toll on a woman's self-esteem. And you're feeling horrible too. Yeah. And then you can't take care of your family sometimes. Some people can't work. Some people have to leave their jobs. So it's a really a difficult life for some women. I'm going to say for all lupus patients because we all have our challenges. But yeah, I don't think people realize how much it really changes your life and how much it affects your self-esteem. And the first thing I would recommend is for everyone to get a counselor, really, because chronic disease changes your life.
Definitely. Any kind of chronic disease.
I really think it's helpful to have like a professional to help you navigate all of that because it's a lot to take in.
You end up grieving your old self, and you need to know how to do that.
Absolutely. Yep.
Because if you don't do it, if you end up like me and you don't do it for so many years and you don't accept it for so many years, you know, sometimes your illness can be worse by the time you
That's
get
true.
around to doing it.
A lot of people have to, well, a lot of people go through a denial period, and so their disease
Right.
is taking control of them over during that time and making things worse. But I think we all sort of go through those stages, and it's normal to do that. But we have to take control of our health immediately when we get diagnosed with stuff like this, because it does do permanent damage. So,
Hmm.
yeah. But it's hard because, like, if you're a mom and you're used to taking care of your kids, or, if you work as a nurse or anything, you have to leave your job. It's hard,
Yeah.
oh, so here's another thing. A lot of spouses end up leaving their wives, which is so sad.
Aw.
I see that a lot in the groups. Men stick around for maybe 5 years and then they bail. And to lose your partner because you're sick, and now you're sick and you're by yourself, like, there's just a lot of sadness in the community. But there's a lot of happiness too, and a lot of support. I don't mean to make it all so grim, but it is a lot of it is a lot of change. It is a lot of change.
It
You
is,
have a
yeah.
friend, right? You have a friend that wrote something for us
Yes, I did.
who does work.
She does work.
Hmm. So what does she have to say about lupus?
So my friend that does work many hours a week, she wrote us a little testimony to read. She says, I am a 40-year-old that has lupus thyroid nodules, Hashimoto's disease, rosacea, lupus blisters on my face. I work up to 60 hours a week some weeks.
Wow.
It has been the most horrible and eye-opening experience of my life. People at jobs I've been in think I'm making up symptoms or trying to get out of working. That is really not the case at all. My body one day is like a 16-year-old and can do anything I want. The next, I'm the most exhausted, overworked, and mentally incapable person alive.
Oh man, I can so relate to that. Yeah.
Right? It's almost like running a marathon and not getting to end it ever.
Mm-hmm.
I've heard everything from hope you get better to get some rest.
Hope
No.
you get better. It's like I have a chronic illness. Yeah.
Right. She says no one really understands, and I get to the point that I downplay my symptoms to people, that's sad. Do you do that too?
Yeah, I think sometimes it's easier to do that than to explain what's going on. So I think we all kind of do that sometimes.
Right.
But yeah.
She says, I've had friends at a job say, you are giving up on your life. Look at the positive in that you are still working and living. Is it really living though? Like never knowing if you can get out of bed the next morning, or running like I do one day and overdoing it at work, and the next day coming to work, not being able to keep my eyes open, forgetting what someone tells me 1 minute and asking the same question over and over the next.
Yeah. Oh my, I can really relate to what she's saying. That we do. If you overdo it, that's exactly what happens. The next day, you're going to pay for it. That's got to be really hard when you're working a job.
Right. The one thing that she does say is one thing that helps a little is making sure I voice my diagnosis to my coworkers. I also recently changed jobs to one that's not as demanding, and she has amazing coworkers now. So a suggestion I have is if you are going to try to work with these diseases and you are struggling with your job duties, and if an opportunity arises, take it. Take the job.
Take a new job. Yeah.
Right.
Yeah.
She says, also a year ago, I thought I was going to have to file for disability, but with the change of jobs and the miracle of CBD oil and edibles, I am at least 80% better. It's always day to day with my disease, but with this and some other medications, I am able to keep working. What I wish everyone knew is that these diseases are different from everyone, and one person can have one symptom and the other person may have something totally different.
Exactly. I think that's the one thing I would want people to know as well. You can't compare. Everyone's different, and every day is different. So you don't know what you're going to get necessarily. So, Angie, what is the mantra for this week?
I think one of the worst parts of having a chronic illness is how it sometimes just breaks you. You can have several bad days in a row and handle it fine. Then one day you lose it because you've gone so long taking it that you eventually get to a point where you just can't do it anymore. After a period of inconsolable grief, you pick yourself up and begin the cycle anew.
So, lupus is a complicated disease with no two people exactly alike. That's the point we've been trying to stress. It is so fluid, so you never know what kind of day you're going to have. Some lupus warriors work while others can't. Some live long lifespans while others die from this disease. That's just a fact. Men and women can have it. Young and old can develop it. It's important that we all support each other as a community because with our combined knowledge and support, we truly are stronger together. If you like this episode, don't forget to share it. We need your support as well. And in just a moment, you will get all the information you need in order to contact us. Please join us next week where we have a special episode planned for Mental Health Awareness Month. Take care, guys.
Mask up. Peace out.
Unified through chronic and mental illness can be found at anchor.fm/unified. There you can find all social media links as well as other ways to listen.